Rob and Marie, it is so lovely to be here with both of you today.
It's great to be here with you, Jillian.
Thank you. As well.
I'm so excited and looking forward to this conversation. I'm going to start, before we get into why it's the two of you here together, I want to start by asking each of you a little bit about your journey to medicine, how it is that each of you came to be doing what you were doing before the part of the story that we're going to talk about in a little bit. And Rob, maybe I'll start with you.
Sure. I mean, I didn't start out in university to pursue medicine at all. I started in biology and then got a little bit turned off by courses in insect biology. And so I switched to psychology and finished up in psychology. And then I got this idea that maybe I would pursue psychiatry. And I liked it very much. And right up until my fourth year of medical school, I mean, psychiatry was going to be my avenue to pursue. And then I did my surgery rotation and I knew I would like it, but I didn't know I would absolutely love it. And so when I applied to postgraduate training, it was just straight surgery in those days. And so I had to do a little bit of tap dancing because I'd done all my elective time in psychiatry and had to convince them that I truly wanted to be a surgeon. And it worked out. And I just love what I do. And then urology seemed like it was the happiness business in surgery. And I've enjoyed every day of my career from that day to this.
Marie, how about you? Respirology, how did you end up doing what you do?
Yeah, good question. So I also studied biochemistry in undergrad, but with a vision of going to medicine or research. I was never, I was always thinking of both. So it was a very happy day when I got into medicine. I studied medicine in Montreal in French at Université de Montréal. And then I went on to do my internal medicine, not knowing really what I wanted to do. In fact, I thought I wanted to do endocrinology. And I had done several research projects and had, really invested a lot in endocrinology. And then once I started doing my rotations and I landed on my respirology rotation, I was really taken with the people in respirology, like the respirologist, and also the patients. Like it just felt like home, and I could see myself doing that. So it was maybe a smaller switch than psychiatry to urology, but it was a pretty clear switch for me to respirology. I sort of found my people, and then I came here to Toronto to do the respirology training.
So I want to move now to talk about the snake bite that set everything in motion. And Rob, I'm going to ask you to begin there.
Okay. Well, I went to visit my daughter in Singapore. She was doing a term away, which was very, very much part of the culture at McGill University where she was studying, to go away for a term in third year. And so I wanted to make sure that she was getting settled well. And about 6 weeks into it, I said, Sarah, I'm coming for a week to visit you. And she said, Dad, we're not staying in Singapore. We're going to Bangkok. And I said, oh, okay, well, I'll make all the arrangements. And your only job is to get me a ride on an elephant. And she said, Dad, you can't do that. That's animal abuse. And I thought, well, yeah, I probably can't do that. And she said, I'll take you to an elephant sanctuary and you can pet them and you can feed them. And I think you'll like it. And I thought, okay, let's do it. I'll humor you. We'll do that. And so we had to hire a car to drive us well outside of Bangkok. It was several hours. And when we got almost there, the driver stopped at this beside the road fruit market. And he said, we're stopping here to get elephant food. And I said, well, what's elephant food? He said, corn and bananas. Well, that was simple. I said, Sarah, you get the corn, I'll get the bananas. We'll rendezvous back here in 5 minutes and we'll get on with our day. So she goes off to get corn and I found this pallet of bananas piled high. I thought, this is simple. This is elephant food. And I stuck my hand into the banana pile and I felt this chomp on my hand and I had my hand spread and it was right on the web space between my thumb and first finger. And I felt it, chomp, and I pulled my hand out and I looked at it and I could see the puncture marks in my hand and I immediately Googled it, as one would, I suppose, and realized that a viper snake would have 2 fangs, like a poisonous snake might have 2 fangs with 2 puncture marks, but I have 5. And so I thought, this is probably not a poisonous animal that that bit me. And then I saw this silvery snake slither out from the back of this banana pile and into what seemed to be the jungle, because we were out in the middle of nowhere, really. And so I quickly decided, maybe not so well informed, but I decided at the moment that this wasn't a poisonous snake and that I was going back to Toronto the next day anyway, and I would just deal with whatever eventuality happened. And so that's what happened. We went on our little elephant tour and we had a great time. And I was going home the next day, but it's a 21-hour flight to get back to Toronto. And by the time I landed in Toronto, I had a temp of 40 and wasn't feeling well getting off the plane, and went to work the next day and spoke to one of my plastic surgery colleagues who looked at it and said, you've got cellulitis from the tip of your fingers up to your shoulder, and I think your tendons are infected as well. And we're going to put you on some antibiotics, and I'm going to put you in a plaster cast. So that happened. And I thought we had a plan. And 3 days later, things weren't getting better. And so, like a great patient, I took the cast off myself and realized that the cellulitis wasn't really getting better. And then I thought, well, maybe I could get an opinion from one of the tropical disease experts. And so I called him up and he said, I don't know what lives in the mouth of a snake in Thailand. But he said, I think you should ramp up the antibiotics, broader spectrum. And so he put me on amoxicillin clavulanic acid. And lo and behold, within 5 days, the cellulitis seemed to be regressing. But I continued to have fevers and chills every night. And then I got all of the symptoms that we associate with Stevens-Johnson syndrome. That took a couple of weeks, but a rash that covered my trunk, sort of a Target-style rash that then coalesced into something very confluent. I had small joint arthritis, all sorts of arthralgias in my hands and wrists. And then the skin on my lips and the inside of my mouth sloughed off, and everything I ate tasted so spicy. Anything I ate, no matter how bland it was, it just tasted spicy because the inside of my mouth was raw. But that all healed up within a couple of weeks. But the thing that seemed to persist were these nightly fevers and profound fatigue. And I was told that, we could plasmapherese you, we could, put you on high-dose steroids, but they don't necessarily work all that well. And maybe the best thing to do is just tough it out. And probably within 6 months, it should get better. Mm-hmm. And so for all those months, I sort of had my fingers crossed, hoping against hope that this would just naturally, resolve into the background. But it didn't. And at 6 months, it was maybe even a bit worse. And 8 months, worse yet. And then about 10 or 11 months, I felt that I didn't really have a diagnosis. It wasn't just Stevens-Johnson syndrome. It was something worse because I was getting worse. And I couldn't function very well at work at that time. And so I spoke to my surgeon-in-chief and said, I believe I need some time to get to the bottom of this. I need to take some time off and just get this sorted. And so I went to a hospital and saw a general internal medicine person one day and went through a whole bevy of tests, imaging up and down and a whole bunch of blood work. And at the end of the day, she came back and she said, this has affected your liver as it can affect end organs, Stevens-Johnson syndrome. We've seen it in kidneys and in my business, I've seen it occasionally. And I knew it could affect livers, but it was so off my radar screen to think that this could be happening in the background. And she said, tomorrow I'm sending you to the transplant clinic. And it was literally like that. It was just an anvil between my eyes. I had no reason to suspect this was going on. And there I was in the transplant clinic the very next day.
Wow. So a span of 8-10 months totally between that first bite, that random event, and finding yourself as a patient in the transplant clinic.
That's right.
Marie, when did you first get wind of what was happening with Rob?
So I think it was kind of March or something when I heard about, when I heard that Rob needed an organ donor, and we heard about it. I heard about it at our division meeting. Mm. So, we were around the table having one of our usual division conversation, talking about everything that's going on. And then that morning, we had all gotten an email from the chief of medicine saying that it was a letter from Mark from Rob's wife, saying that Rob was sick and that he needed a liver transplant, and that they were looking for an organ donor, and that they were looking, and that one thing that an additional detail that was in that letter was that Rob was O negative, right? And that they needed an O negative donor. So we're sitting around the table in our division, and everyone's like, Marg is one of our colleagues, right? Yeah. And Rob is one of our colleagues. And in different, we have connections with both of them. And everyone, I think, at that table was like, what are we going to do? Like, what can we do? Like, how do we help Rob find a donor, But I think maybe I felt it even more that day because I'm O negative. Yeah. And I was just like, right, like I could do this, and so that was kind of when my thinking started about it.
So you started thinking at that point. And what happened as you moved from that period between contemplation and taking a first step, the first step of a very long process? Take us through that.
I think that making the decision, was the hardest part, actually. So it's, I think at first I just asked random people questions, without revealing anything. Because maybe it was a crazy idea to even be thinking about it. But I remember at that division meeting saying, well, what's it like to be a liver donor? And several people at the table said things, but probably with not all that much information, maybe it takes a few months to recover, or, there was sort of some very vague information. And then I just, I kind of thought, okay, like I wasn't consciously thinking about it yet. But then it seemed like every day when I got on my bike ride home, which is always when I do my clearest thinking, it just kept coming back to me. I was thinking, well, Rob needs he needs a donor, and why isn't it me? Yeah. And so I would go through all these reasons. Well, I have patients to look after. I've got my kids, and I've got, et cetera, et cetera. And then I realized after like a couple of weeks of this that I didn't have enough information, that I really needed to know. I needed to ask someone who could really give me detailed information so I could decide. So lucky me, one of my cycling friends is a liver transplant surgeon. So I just messaged him one day, sort of randomly, and said, hey, like, what's it like to be a liver donor? And he said, why don't we meet for coffee tomorrow? So we met for coffee, so this is an amazing thing, right? To be able to message a liver transplant surgeon and say, hey, can you tell me what it's like? Without telling anybody else that I'm asking this crazy question, because I was wondering if it was a crazy idea. Yeah. So I met with Gonzalo, and he told me about it, basically. And I told him why I was asking, but I said, I have no idea if this is the right thing or not, but tell me what it's about. And by the time he wasn't trying to convince me, he just kind of said it like it was, and said, this is what the surgery is. Here's some, this is our experience in the UHN program. And by the end of the conversation, I was like, well, that seems pretty doable. Like, what do I do next? Yeah. And so from there, I signed up. Yeah. Like I went online and filled out a form to say, yes, I'd be interested in doing this. And then you kind of wait to hear, right? So he did tell me that they only assess one person at a time. So you might sign up and hear nothing for a while. So it was a couple of weeks I didn't hear anything, but I thought, okay, this is good. I made at least the step to get checked, But that was a very important first part of it. And it meant a lot to be able to ask a friend who was so knowledgeable about it. Like a special thing as a doctor, right? That we have these friends who can really tell us like it is. And also that it didn't seem that scary to me. Mm-hmm. Like I was still worried about, like that was the medical part, right? I was still worried about work, patients, family, all the other things on my list, but at least the medical surgical part didn't seem that scary to me because I had all the information and I knew what it meant, so that was a very important first step.
That demystification of the process in a language that we already speak, as
Exactly. So that was kind of like the first step. And then I didn't tell anyone when I did that, but my husband was away when I signed up online, and then when he came back, I was having dinner with him. That was kind of the next step because I thought, well, I need to tell him before it's too far along. Need to see what he thinks. So I was having dinner with him And we were just having a nice dinner talking. And I said, there's something I want to tell you about. I've been thinking about this thing. And I told him, and it was like the end of the conversation. Like he was like crickets for like the rest of dinner. So I was like, I just sort of floated it out there, but he was clearly blindsided by it. So I needed to give him a bit of time to process it, and he did. Like eventually, like a week later, I said, I wanted to ask you again about that thing about the liver. and basically he said, like, is there any chance you're going to die doing this? And I said, no. Here's the data from Gonzalo. I've read the paper, and these are the things that could happen, but not that. He said, well, then I think it's good. I think if you want to do it, you should do it. So that was a second really important part of the process for me.
Big milestone. What I really hear in what you were just saying is that gulf between the uncertainty of what something will really be like, and then the necessity of filling in those gaps with actual information.
Yeah.
And it just makes me think, Rob, of your experience as a transplant surgeon, albeit a different organ. What were some of the gaps that you faced when you were now in this situation in the transplant clinic? What you might have thought that you would know that you actually had no knowledge of whatsoever?
Yeah, exactly. I mean, they said to me on that first appointment, Rob, you need a transplant and you should start looking for a donor. And frankly, I had no idea where to begin. There's no clear algorithm here. Yeah. There just isn't. And it was pointed out to me by a senior surgeon in the program that I couldn't be an advocate for myself. It doesn't work. It's too awkward for the potential donor being approached like that. I need a liver. That's difficult. And it's awkward for me to ask. And so he said, and it was very good advice, get somebody to be your advocate. And Margaret did. I mean, she just really stepped up and did it. And she took it on like a huge project. And she was on her laptop at 4 a.m. every day, contacting colleagues and friends in Europe and elsewhere. And that seemed to be very helpful. And other folks have social groups that they can reach out to. I mean, the first people who came forward were all of my family members. Yeah. But for various reasons, it didn't work out. I'm 6'2", and there's a size matching element that has to be considered, et cetera. And so my family members didn't work. And so then the next sort of concentric circle were friends, colleagues, and things like that. And so that, and as a kidney transplant surgeon, we don't get involved in the search for a donor kidney. We meet the recipient at the very end, close to the time of their surgery. And so all of this has already transpired. And so I knew it went on, of course, but I didn't have any firsthand experience with people searching for a donor. So that part was really new to me.
It's interesting, when you talk about through the process needing to appoint an advocate and that being a very clear requirement for it to be someone else. I think there are a lot of people outside of the medical community who would assume that being a physician going through these things, and as we talked about, there are definite advantages. There are ways that our socioeconomic status helps us. There are ways in which being part of the medical community, we speak the language already. There are lots of things that we do know. But there are some paradoxes there, right, in terms of being able to advocate for ourselves and being in the role of patient. And I wonder if you could talk about your experience navigating some of those things, Rob.
Well, being a patient was an entirely new experience for me. I really didn't have much background experience. I didn't have a way forward. I didn't know how to conduct myself as I was learning slowly to become a patient. It's a gradual process. It doesn't happen overnight. And I initially, I remember vividly sitting in these waiting rooms, the transplant clinics, they're big waiting rooms with lots of people. And I would just sit there and look around the room. And of course, you invent a story for everybody that you see on a regular basis at these appointments and try to understand what their situation might be like as you bide the time. And, as a physician, all of us can resonate with this idea of having a busy clinic, taking one patient's chart, going out to a waiting room, calling that patient, ushering them into an examining room, and you are sort of laser focused on that individual in that moment. But in the waiting room, as I was learning to become a patient, what I started to realize was an appreciation of the collective suffering. You look around the room and everybody is suffering. Everybody has a story. And in many cases, it was a story that was so much more harrowing and frightening than my own.
You make me think of the concept of inattention blindness, that really, we are trained to focus on the one thing in front of us, to tune out everything else, to look at the lesion as opposed to everything surrounding the lesion. And it is an unlearning process when we sort of learn to see things again with different eyes. It is doesn't necessarily go with that conditioning.
Yeah, very much so.
Yeah. So Marie, you were also a patient. What was that like for you?
It was a really good experience for me, actually. It was, it's a pretty different thing to decide to be a patient than, doesn't happen very often, I think, So it's a very different experience than, I think, being sick and having to deal with illness and deal with, this unwanted, unexpected situation. To me, it was something I very clearly decided to do. And in fact, once I found out that I was a good match, so to speak, I was really excited to move forward, So I honestly felt a lot of excitement about it, a lot of nervousness about planning, but a lot of excitement about moving forward. And I think, and the other thing is that the team at UHN, they were amazing. So everything was like super organized and everything went according to plan. So it was really a remarkable experience for me, the one thing it kind of makes, I remember that I found a little bit difficult is when we were in the hospital afterwards. I say we, because we were on the same ward. Okay, right? But I remember being really self-conscious about hearing whether people were sanitizing their hands or not when they were coming in to see me. So it was one of those kind of painful things of being a doctor and too much because the sound of them sanitizing and whether they were rubbing their hands long enough.
And the sound of them not sanitizing.
Right. And so I'd be like, oh, hi, And so I found that I was in a bit of a heightened awareness state because I didn't want to get sick and I was going in there healthy and wanted to come out healthy. But really I had, they were stellar. It was really, so I had a very good experience.
There's a moment that Rob told me about a little bit earlier that I wonder if you could expand on. Yeah. And it was sort of a moment in conversation between the two of you when your liver really became in conversation between the two of you, right. Rob's liver. And we were talking about when does that happen? When is that transition? So what was that moment for the two of you?
That's a good question. I remember pretty soon after that we were talking about it and Rob and Margaret always so grateful, and I remember saying at a certain point, and I think this might have been what you were talking about. I was like, you know what? It's fully yours now. You don't need to keep thanking me for it. And and Marg would be like, Rob's going to take good care of that. And I was like, it's fine. It's fully yours, no take backs.
With respect, Marie, it was even more than that because we'd had coffee that day. And I had brought up this idea of, I'm trying to take good care of your liver. Right. And you didn't say anything at the time, but when we got out of the coffee shop, you squared off with me and you said, Rob, and you hugged me and you said, Rob, this is your liver now. Don't talk about it in any other way.
I'm glad you heard me.
I heard you. I did. But it was a very meaningful moment for me because it's a gradual process to then believe that this is something that's for you because, becoming an organ donor is the purest of elective surgery. And that altruistic gift, is an extreme expression of empathy. And so, Marie was such the hero in this exchange because she had a big decision to make. I didn't have a decision to make. There was nothing I could do about my situation. I couldn't help myself. And that was probably the most frustrating thing of all. We're used to being in the driver's seat, turning the dials. We're all sort of type A personalities. And this was very difficult to be a passenger and be out of control and feeling helpless.
So that just takes me back to something Marie was saying a few minutes ago about the locus of control, sort of making the choice to do this. And we have some very positive framing in terms of what it feels like to make that decision, make that step, how it is actually, reclaiming sort of that same being in the driver's seat feeling that you talked about, Rob. I wonder if you have any other thoughts about that, Marie.
Yeah, it felt like, it felt great to make the decision. Yeah. And it felt, and in retrospect now, I think that it was an amazing experience. And like, I'm so glad I did it. Yeah. It's like the best decision I ever made. Yeah. and so I think, I feel really good about that. And I kind of think, wow, I could have missed it if I had just sort of kept thinking why it wasn't a good idea. So you're right. It was, a big part of it was figuring out whether it was a good idea. And also like, part of making the decision and having the decision be a good one was also all the people around me, So once I went through like the medical part and then, then it was like, okay, is this going to be okay at work? And is this going to be okay at home? And both home and work people were just like, a huge yes. Yeah. so that was really neat. And that gave me kind of the extra courage to make that final step, and really decide to do it. And I'm so glad I did.
And I love that framing. I think you really enrich our understanding of the fact that it was, clearly the person at the center of the effort was you in terms of the donation, but there was just this, real practical, tangible, necessary support from your 100%. Colleagues and your medical community and your friends and your family. And
100%. Like, and at work, it was really, it really kind of blew me away. Yeah. Like the minute I told people at work, because I was like, I'm going to have to figure out some coverage and, make some arrangements and ask for some favors. And the minute I told people at work, everyone was like, what can we do? How can we be part of this? And it was really touching, actually. Surprise is not the right word, but I wasn't ready for that because I'd been so worried about the details that I had forgotten that, when you want to do something special and you decide to do something that, generous or to help somebody, other people want to be part of it, so that was amazing. So it was actually really easy, like all of the arrangements at work and making all those coverage plans, and everyone wanted to help out.
You can just sort of hear it in your story, just taking on a life of its own, and enlivening, giving everyone a positive focus of something at a time of, again, when that control
really true,
taken away. Yeah.
And even when I came back after, like coming back it was hilarious to me because everywhere I would go in the hospital, people would be giving me thumbs up. I was like, people I didn't know, and okay. And so, that was really special. Or I'd see a patient and they'd say, I'm also a patient of Dr. Stewart's. I don't know if I ever told you that. People would say, and I'd be like, oh, and they'd say, we really appreciate what you did for him. And it would really surprise me, so it came at me all these different ways at work afterwards. And it just gave me a real sense of like how, just like you said, like people, it means a lot to people to be part of something positive. And it meant a lot to me to have this community that kind of joined me in this. And it made me feel more confident about the whole plan,
Well, you just make me think of too, we're so overwhelmed with horrible things, negative cases, difficult outcomes, suffering. But if we can when there's something that people can believe in, something where a person can see, a different trajectory, a different path, a whole other ending to the story. Right? It's so powerful, and especially for a community. That's amazing. Rob, I want to go back and talk a little bit more about physician as patient, because certainly one of the things in our series, we've had the opportunity to talk, and we'll continue to talk to physicians who have faced life-altering diagnoses. And I know one of the things that I think it's really helpful for us to explore together in these conversations are the barriers, the things that are conditioned into us. We talked about the type A personalities, but also the medical exceptionalism, the things that we are marinated in terms of medical culture that can influence our behaviors, again, in ways that the general public might not understand or might think are completely illogical for us as physicians. I wonder, as you move to this other part and phase of your life now, and certainly one where everybody knows that you have been and continue to be a physician patient, what other things have really been illuminated for you?
Well, a number of things. I mean, I think that we can talk about the physician as a patient. We can also talk about the physician who is looking after a physician who is a patient. And so it's all sort of part of the same, but it comes from a different angle, a different lens. And the two are very much intertwined at times. And I think that when a physician becomes a physician of another patient, it can sort of challenge our equanimity a little bit. Boundaries become blurred and assumptions are made, as we all know. People tend to talk over your head quite a bit. And I was really frightened that people would assume that I had knowledge that I may not have, and that they would talk over my head and there would be gaps in my understanding of exactly what was going to happen. And so I made it clear with all of my doctors, please talk to me like you talk to all of your other patients. Don't let all of these years of training and rigor go out the window because you think, you're going to do me a favor by cutting a few corners and just getting right to the, final statement. I really needed to hear it like all patients needed to, in part because it was overwhelming for me emotionally, and I wasn't well. I wasn't thinking as clearly as I normally would. And so for a number of reasons, it was really important for me to be treated just like a patient and not to feel that someone was trying to go the extra mile for me by talking to me at a very high level or something like that. I didn't need that at that time. And the doctors and the nurses and the allied health professionals were fantastic at that. I mean, they were so skilled. Yeah. And they immediately allayed any fears that I might have had that would be the case, that it would sort of turn out that way. It didn't. They were really, really excellent at what they did. But somewhere in our training, I guess, we get armored up to believe that we can't experience disease because we cure disease, and that we are somehow different from others, when in fact we are as vulnerable as all of the patients we treat. And one of the other things that I started thinking about as I was going through it was that we have this compassion and empathy for our patients, and it's very real. It comes from a very real, genuine place, I believe. And yet when we get sick ourselves, we judge ourselves. We see illness in ourselves as weakness. And I couldn't get over that for the longest time. I carried a big stick and flagellated myself for getting sick. And we need to allow ourselves to have, or permit ourselves, I guess, to experience illness the same way as the people we care for. Yeah. And I think that it can extend even within our community to something that is also to be unwished for, and that is when we judge our colleagues who get sick. Yeah. We need to be more caring, we need to be more accepting within ourselves. And I think that, pushing for better wellness within our medical community is something that's always worth striving for.
There's so much to take apart in what you just said, but one thing I really think is this idea of compassion, that compassion for other people. We know that in many cases, physicians, people in general struggle with self-compassion, but in medicine, of course, there is this perception that exists in certain quarters that self-compassion is a kind of weakness, a kind of self-indulgence. We are averse to it, despite literature that tells us that actually it does make us better doctors and does help with personal resilience, et cetera, et cetera. But there's also something curious in there that I think ties right back into those roots around medical exceptionalism. Because on the one hand, it's like, I don't deserve this, what other people have. But there is a kind of, again, grandiosity in that conditioning. I don't think we come to medicine embedded with this idea. I think it's implanted and sort of evolves as we live in this professional culture for a long time. But gee, if I must be terribly special if I'm not worthy of the same compassion that everyone else is. So there's even this flip side to it that isn't just, it's not just I don't deserve it. It's like I'm special, so I don't deserve it. Like it's a complex or need it or require it as well. Exactly. And this piece that you talked about, again, I think is so interesting of of berating yourself for getting sick, but when we think about it and we think about what else are we conditioned to do, work without sleep, work without food, work without expressing emotions. So it really isn't a far distance to go then to think, well, I should also be able to work without getting sick. And this is one more, again, interesting thing to tease apart.
It is. And we have this medical mantra, and we're all very familiar with it. And that it goes something like this: push harder, push even harder. And that for sure is not conducive to healing oneself, for sure.
Yeah.
And so that's something that I think that, if as a community we explored more fully and shared more honestly, it could make us all better at what we do. And at least how we care for ourselves is a big piece of that.
I think in terms also of this idea that you mentioned of, treating colleagues who are our patients, you make another point that is so, should be so apparent, and yet I think it so often is not, whether it's when we are patients or whether we're caring for colleagues as patients. And it's, we forget that in the moments when we're not well, our brains are not functioning in the same way that they are when we are at work as the attending physician or the physician in clinic. And it seems so obvious it shouldn't even need to be said. And yet, I think time and time again, we make some of those cognitive shortcuts caring for each other. We think, well, I feel silly telling Rob this because surely he knows this. And then maybe Rob is going to think, I don't think he's very smart. And we get caught up in all this kind of narration related to power dynamics and hierarchies and pre-existing relationships, when really there's a need for kind of returning back to basics. And you said something else a while ago before our interview today, but you talked about this perception that we have that some of these shortcuts and curbside consults are added value. Could you just reframe that a little bit? Because I thought that was such great framing.
Well, I think oftentimes that we are trying to do our colleagues a favor. I'll see you in the hallway, and we'll just quickly go over your symptoms. But in so doing, we throw out the rigor of our training. We really try to distill it down to something that's maybe not fully illustrative of the larger problem. We don't appreciate it with the same rigor that we would normally. And in trying to do a better job for our colleagues, I fear that it's possible at times to do a less good job because of these shortcuts that sometimes take place. It's not always the case, but it can happen. And I think we can all see how we could be vulnerable to doing so.
Yeah. Do you think, in your experience, that when we are seeing colleagues or other healthcare workers as patients, that we ask enough about their emotional suffering, or is that something that we maybe handle differently as well?
I think we handle it differently. I know I did. For sure I did. I underplayed it because that sort of, doctors don't get sick type thing. And now, as I have learned, or am still learning, to be a patient myself, it's a very gradual process. Even though your traditional hierarchy, in my case, got flipped upside down, and not gradually, but in an instant, in my experience. But still, it is a growing period of really internalizing the fact that you are a patient and in need, and that you can't always make the best decisions for yourself. You certainly can't heal yourself in many of these situations. And you're so dependent in a way that maybe we haven't been before. And that's a new role for us to grapple with.
Rob, you talked about a couple of things that were really impactful and surprising about the whole experience. And I wonder if you could share those now.
Sure. When I was told that I would require a liver transplant, I had no idea what that involved. And I alluded to that earlier. I didn't know how to begin. But as I began to search, I started to realize the importance of how anonymous the donor-recipient issues have to stay by necessity. They have to be kept very separate to be respectful of a potential donor who may have a change of heart at the 11th hour or something like that. It has to be an anonymous, separate workup. so as to eliminate, any possibility of coercion, for instance. And while I understood that intellectually, to experience that frustrating opacity was just challenging, because I had all these doctors who were cheering me on. They were saying, Rob, just keep running. We're looking for a donor. We're looking for a donor. Just keep running the race, but you have no idea where the finish line is. You just don't. And so that, sort of, again, that loss of control was really a challenging part of that process.
So I want to go back for a moment to a bit of a bigger picture worldview. And I'm going to ask you first, Marie, how has this experience changed your perspective on medicine and life?
I think the way that it changed me the most is it made me realize the privilege of the position I have. And that being, and to think about privilege, and this is something over the last couple of years that I've thought more about when I've tried to talk to people about being a donor. Actually, I'll take a step back. Rob and I decided the day after the surgeries that we were going to talk about this, right? And that we had decided that we were, even before, that we weren't worried about our confidentiality. Yeah. We were going to talk openly about it because everyone was going to know anyway. So maybe it was better that they weren't whispering. But that we, as the days unfolded after the surgeries, we agreed that it was important to talk to other people about it. And so that got me thinking about, what is it that I want to say to other people about it? And one of the first things was that, that it was not that difficult to do this. And then that made me really kind of think about the fact that one of the reasons it was not that difficult for me is because of this lucky position that I'm in, as you mentioned before, like we have financial stability as doctors. And as I mentioned before, we have a lot of knowledge about, the process and the surgeries and the recovery. So all those things kind of take down a lot of the obstacles and scary things, So it made me, I think it made me think about that and be prepared to talk about it. Like I remember going to talk to someone about the experience of being a donor and talking to my daughter about it first. And my daughters are very wise. They always teach me things. And so I was saying to my daughter that I wanted to talk about the fact that having this position, there were some things about the privileged position that I'm living in that made it possible for me to be a donor, but that was uncomfortable for me to talk about. And she said, you know what, privilege, like she taught me such a simple thing. She said, you don't need to deny your privilege. You need to acknowledge it and do good things with it. Wow. And so that made me think, maybe that's what this is. And maybe that's what I can share is that, maybe as healthcare professionals, as doctors, we are in a privileged position, and maybe that makes us really good donors, for a lot of the reasons I said already. And since doing the surgery, I've had two pretty close friends, or part of my personal family connections, kind of thing, who have donated livers. Wow. And so that was really neat to me to be able to use my experience and the fact that I was game to talk about it meant that people came to me and asked me questions, and I was able to help them feel comfortable in their decision process. Wow. So I think those were the most important things for me.
Yeah. That the way that we influence the people around us with our choices in ways that we might never imagine is what I really take away from that.
Yeah, it was 100%.
Wow.
Marie, I remember even before the surgery, we talked a few times.
Right.
And just sort of getting a sense of each other and how we felt about what we were about to do. And just before the surgery, we talked, and we agreed, I think, that we both felt pensive, but not scared.
Yeah.
And
the night before the surgery.
The night before the surgery, yeah. But at that time, I think we even agreed then that this was something that we were going to talk about and share our experience, whether it was good or bad. Yeah. Ultimately, it was wonderful.
Yeah.
And we were very lucky. But it was something that we would openly share with others to the extent possible, because it's such an important thing to consider. I mean, the idea that we can be an organ donor and save someone's life is profound.
It has just been a privilege to have this conversation with you today. It's amazing to hear your story, to see you together, and to hear both of you sharing this incredible experience from different vantage points, but ending up in the same place.
Well, thank you for having us.
Thank you.
Karen.
Thank you so much.
It was a real pleasure.
Oh, pleasure was mine.